Hey folks, it is Weekend Therapist and I'm back with another video. By now, you know that it is Black Maternal Health Week. And I would be remiss if I didn't really bring some insight into how psychology plays a part in this. See, as we know, Black women are 2 times and sometimes 3 times more likely to die during childbirth or to have complications. And knowing that, I went back and thought about some of my earlier courses during my clinical program. See, there's a section of psychology that we oftentimes don't really speak to, but we know about. And I wanted to share with you a couple of different facts. So, in fall of 2020, when I took my very first psychopathology course, we studied a group of disorders called the somatoform disorders or somatic disorders. And I want to read directly from my text because I think it will make sense there. So, the essential features of a somatic symptom disorder are: the client expresses concern about one or more distressing or disruptive somatic symptoms, i.e., physical, felt in the body, that leads the patient to express a high level of health anxiety, to invest excessive energy and time in healthcare, or to think excessively about the seriousness of symptoms. Now, how does that tie to Black maternal health and Black people in general? So, I want to talk about medical racism and clinical bias and how it's insidious and it's layered in and snuck in these texts. See, as a Black man, I can read between the lines, but some things are just so overt that you can't ignore them. And so, in reading from my psychopathology text, it says 5 to 10% may meet the diagnostic criteria for somatization disorder. In the United States, it tends to be more common among African Americans, lower socioeconomic groups, and less formally educated people. So now you may see how this is a problem. Black women are not being heard. Black people are not being heard because it's being chalked up to it's all in your head. You don't feel that pain. You're not experiencing that pain. We can't find anything that suggests that you should have this pain. We're in a system of things. And as a clinical provider, I'm glad that I get to be able to disrupt that system. One word: advocacy. We all need to advocate for each other. All right. Peace.